Why are dementia assessment wards and their nurses continually overlooked? This is a comment piece by Ian Davies-Abbott, Assistant Professor in Dementia Studies at the University of Bradford, and John Keady, Professor of Mental Health Nursing and Older People at the University of Manchester. It is read to you using an automated voice, so some words or phrases may vary from how you would usually expect to hear them. While service arrangements differ across the UK, in England, specialist inpatient dementia assessment wards are usually provided under the auspices of NHS mental health trusts. Dementia assessment wards admit some of the most vulnerable people with dementia in society, with the admission expressly for the assessment and treatment of the person's dementia. All grades and levels of staff working on these wards can be subjected to a high degree of violence and aggression. Owing to concerns over the person's capacity to consent, most people with dementia admitted to such wards are compulsorily detained under a section of the Mental Health Act 1983, with the average length of stay being around 100 days. Mental health nurses are the largest professional group employed on dementia assessment wards, and yet their roles and skills are poorly documented and practically invisible in research, education and policy initiatives. For example, practice on dementia assessment wards is not mentioned in either of the Prime Minister's challenges on dementia in 2012 and 2015, and it is absent in the positioning of research priorities in NHS England's 2022 Mental Health Research Programme. Indeed, a recent scoping review by Emma Wolverson et al. 2022 found only 36 studies worldwide that addressed characteristics, care and outcomes for people admitted to dementia assessment wards. None of the studies focused on the contribution of mental health nurses. Such oversights are concerning as mental health nurses, unlike other professional staff groups, are present on the wards 24 hours a day, 365 days a year, and are responsible for the person with dementia's day-to-day management and care planning, delivery and discharge coordination. During a typical admission, the role of the mental health nurse can also extend to supporting visiting family members and carers. This support can be complex, with visiting family carers often experiencing a range of emotions, including guilt and distress over the circumstances of admission, particularly when complicated by the use of the Mental Health Act 1983 to forcibly remove the person with dementia from their home. Family carers may also struggle to deal with the transition between hands-on family carer to ward visitor, which will involve encountering a secure and locked environment of care, which is controlled by ward staff. Such a context leads to an uncomfortable question. Given the undoubted vulnerability of the client group and visiting family carers, why are dementia assessment wards and the roles and skills of mental health nurses practicing there continually overlooked? Perhaps one response resides in the past as, historically speaking, care of people living with dementia has been regarded as largely unskilled, task-based work and unworthy of detailed time and attention. Indeed, dementia care is often referred to as a Cinderella service, although critics could point to the high cost of dementia care, and most NHS mental health trusts could indicate their own policies prioritising dementia care. However, policies often concern the timeliness and quality of an early diagnosis of dementia rather than the quality of care provided on the dementia assessment wards. As mental health nurses and researchers working alongside frontline mental health nurses practicing on dementia assessment wards, we have attempted to provide some initial insights into care on these wards. For instance, our work has reported on inpatient care during the COVID-19 pandemic, the relationship between language and practice, and developing a better understanding of the complexity of care provided by developing a new model of care. However, this is just a start, and we need more research in this area, led by mental health nurses for mental health nurses. Without this, a cloak of invisibility will remain firmly wrapped around the skills and practices of mental health nurses on dementia assessment wards. To access the full article with references, visit nursingtimes.net and search under the dementia topic. There you'll find a wealth of resources, including articles to support your continuing professional development and revalidation requirements. We thank you for listening.